Hi, everyone. I'm Dr. Erin Sellinger, and I have Alysha wollak-larson here, our medical esthetician at Zelskin and Laser and Edina. And today we're going to talk about acne, which seems like a timely topic since a lot of us are stuck at home and wondering what we can do to try to get jump-started on a regimen. So this is an overview of what we'll be talking about today. Hopefully at the end we'll have time to take some of your questions you may have. So without further ado, we'll proceed here. So acne is fundamentally a disorder of the hair follicle with its attached oil gland, and we think it results from a variety of factors. It's very common in the teenage years, but we do see it persist in a subset of individuals even into adulthood, and that tends to be more common in women. It can range from mild to severe in severity, and the tendency to develop moderate to severe acne, we do tend to see it run in families. Acne can leave behind dyspigmentation, it can leave behind scarring, and as a result of this, we do see psychosocial repercussions, even with just mild acne, which is why we try to be aggressive with acne treatment at its first onset. So when you come to the office, what we're really trying to do is look at your acne and break down whether it's inflammatory acne or non-inflammatory acne, because we treat these conditions differently. Non-inflammatory acne are what we call comedones, or whiteheads and blackheads. I have some pictures here to illustrate what these look like. And these comedones result essentially from the trapping of dead skin cells that we're supposed to be shedding off and oil within the pores on our face. So on the left here is a closed comedone, or what we call a whitehead. As you can see, that those debris that are trapped in the pore are kind of trapped right underneath the surface. Versus the picture on the right here is our open comedones, or our blackheads, and that's not dirt that's within the pore. It's all of those skin cells and oil. And because it communicates out to the open surface of the skin, if the contents of the pore get oxidized. So that's what makes it look black or brown. Conversely here, then we're going to talk about inflammatory acne. So inflammatory acne is when we start to get those pink-red bumps, those pus bumps, and this type of acne can be painful. The pink-red color is really what indicates to us that there's inflammation going on within the skin. This can result from a variety of reasons. We think of the comedone as being kind of a precursor lesion in acne that can progress to this type of lesion, but this can happen even independently. It happens, one, from bacterial proliferation within the pores, and just the presence of bacteria alone can upregulate inflammatory processes in the skin. And then the second thing that can happen is once our pores start to accumulate the bacteria, the dead skin cells, the oil, occasionally those kind of pore contents can rupture open underneath the skin, and that further upregulates those inflammatory processes. And I present a kind of a third category of acne here just because it's unique in its presentation and in its treatment options, and that's hormonal acne. This most commonly affects women over the age of 20, though I do rarely see it in some teenagers, and it can even persist beyond menopause for some women. It does tend to flare in the week prior to menstruation, though certain progesterone-heavy types of birth control, such as the Mirena IUD, Depo-Provera shots, or the Nexplanon arm implant, those are all kind of progesterone-only types of birth control that can definitely make this hormonal acne worse. And as a rule, it tends to favor the lower face, jawline, and neck, though certainly we see it other places on the face as well. So moving on to acne treatment, the good news is that there are a ton of acne treatments out there, and sometimes I always tell my patients it really just, sometimes we just have to hit a right combination and a regimen for you. So don't get frustrated if the first thing you try doesn't work. In the office, we break it down as kind of two categories: our topical treatments, which is our creams, our gels, our cleansers, versus our oral treatments, which are our pills. Really, the oral treatment options for acne are all prescription only. And if you're interested in that treatment option, it's a good idea to touch base with your dermatologist. And as I mentioned, it's important to kind of look at your skin, determine what kind of acne is present, because that is what helps guide our treatment regimen. So when thinking about how to treat comedonal acne, or just those blackheads and whiteheads on the face, this treatment is going to be largely topical, meaning creams, washes, gels. Some key ingredients that are really well suited to treat comedones on the face are retinoids, azelaic acid, and then certain other type of acids such as salicylic acid, glycolic acid, and lactic acid. And it's important to note here that all three of these active ingredients are available in some formulation over the counter, which is very convenient. When you start to develop the inflammatory acne lesions, that's when we really kind of start to expand our treatment repertoire and may incorporate an oral treatment into your plan. The list of expanded topical treatments here is now including some antimicrobial agents, such as benzoyl peroxide. As you can see, there's a lot of different active ingredients in various topical formulations that can help your acne. Some of them are prescription only. So again, if you have questions about these, a good idea to touch base with us. And then for oral treatments for acne, really there's kind of four main categories I think about when counseling my patients. One being oral antibiotics, which are meant to be kind of a short-term treatment plan. Second, birth control. Oral birth control pills can actually work fabulously for acne, but it's important to touch base with your dermatologist because there are some birth control pills that can really benefit acne, but there are also conversely some birth control pills that can make acne worse. Accutane, I'm sure many of you have heard of this medication. It's kind of our old standby for moderate to severe acne. Its generic name is isotretinoin. And then there's anti-androgenic oral pills such as spironolactone, and that's when we're thinking about that hormonal acne that we typically bring this treatment in. So I want to talk about some over-the-counter all-star ingredients that are going to be a really nice starting place for you if you're at home trying to put together a regimen to get started here. So the first ingredient I want to highlight is salicylic acid. It's a beta hydroxy acid. You may see it abbreviated as a BHA. And what it does is it kind of gently exfoliates the skin, but because of the structure, it can actually penetrate further down into the pore to kind of help clean out some of that debris. AHAs, such as glycolic and lactic acid, work similarly, but they do not penetrate the pore as deeply, but again, work in a similar manner. And salicylic acid is really ideal for blackheads and whiteheads, the comedonal acne, but can also be an effective part of a treatment regimen for inflammatory acne. What I have here is pictures of 3 of my favorite salicylic acid containing cleansers. On the left is the La Roche-Posay Effaclar. Effaclar is just their acne line, but their medicated oil cleanser containing salicylic acid. Kind of an OG face wash, the oil-free acne wash from Neutrogena. The orange bottle there in the middle is a nice salicylic containing cleanser. Their updated grapefruit oil acne wash is a pink bottle, and it just kind of incorporates vitamin C. And then on the right is the MD Complete Clarifying Cleanser. So these are all nice, readily available salicylic acid cleanser options. The next ingredient I want to talk about is benzoyl peroxide. Benzoyl peroxide is an antimicrobial agent, so it can help eliminate the bacteria that can contribute to breakouts. It also helps the pore shed dead skin cells and excess oil. So we think about kind of including benzoyl peroxide when inflammatory acne lesions are present. It can be kind of drying and irritating. And one important caveat is that it can bleach clothing, pillowcases, towels. So it's really important to make sure if you're using it as a cream or a gel on the face that it's completely absorbed before you're pulling clothing on or off over your head. Or if you're using it as a face wash or a body wash in the shower, you just want to make sure you rinse it off really well so that you don't ruin your skin or your towels when you're drying off the skin. So some of my favorite benzoyl peroxide cleansers are included below. On the left is the Neutrogena Clear Pore Cleanser / mask. I like this because it's kind of dual purpose. You can use it as a mask, you can use it as a cleanser. It's 2.5% benzoyl peroxide, which is a very low percentage. It's about as low as you're going to be able to find over the counter. So it tends to be a little bit more gentle and is a nice starting point if you have kind of very dry, sensitive skin, or if your acne is more on the mild end. CeraVe, one of my very favorite drugstore brands, recently just came out with a benzoyl peroxide cleanser. It contains 4% benzoyl peroxide and is well suited to most skin types. Clean and Clear is an old standby. They make a 10% benzoyl peroxide wash, and I typically think about recommending a 10% wash when acne affects the body. So you use it in the shower as a body wash for chest and back. Though certainly some oilier skin types or those with more severe acne may be able to tolerate it on the face. And then lastly is the Panoxa wash. That one comes as a 4% or a 10%. You can also use benzoyl peroxide as a spot treatment, and there's really 2 main ways to do this. One is to use it as what I call field treatment, where you're kind of putting a thin layer over all the areas where you get acne. So, maybe it's just your forehead, maybe it's your entire chest, your entire back, but you're kind of just putting a thin layer anywhere where you tend to break out. If you use it this way, I recommend just doing that once a day. The other thing you can do is if you just have a few inflamed spots, you can kind of individually spot treat and put a thin layer just on the acne blemish. If you're just doing spot treatment, you can usually get by with doing that twice a day. And these are some of my favorite over-the-counter spot treatments available, one being the MD Complete Breakout Treatment, the Neutrogena Clear mask like I recommended. They also have a rapid clear that is 2.5% benzoyl peroxide, and then the La Roche-Posay Epiclar, and that one's 5.5% benzoyl peroxide, so a little bit stronger than that Neutrogena one. The last over-the-counter ingredient I want to talk about is retinoids. We hear about retinoids a lot because it's a key ingredient we use for anti-aging, but it's a wonderful ingredient for acne as well. It's a vitamin A derivative that helps to normalize skin shedding. So by normalizing that skin shedding, we think it helps to prevent those pores from getting clogged up and forming the acne bump there. We also know that at a cellular level, it actually acts to inhibit various inflammatory pathways involved in acne. So kind of a complex ingredient. This one also can be drying and irritating, again, because of that increased skin turnover, normalized skin shedding. So I always tell my patients a little bit goes a long way. The only over-the-counter prescription strength retinoid available is adapalene 0.1%. So Differin has been around longer. Differin makes a whole line of washes, moisturizers, gels, etc. So you want to make sure if you're looking for the retinoid that you're getting the adapalene 0.1% Differin acne treatment gel. And then La Roche-Posay with their Epiclar line also just came out with the adapalene 0.1%. So if you're kind of wondering what, a very basic regimen that you can do at home with readily available products may be, here's what I would recommend. So if you just have blackheads and whiteheads on the face, in the morning I would start with a salicylic acid cleanser of your choice. I would follow it with a non-comedogenic moisturizer. And non-comedogenic just means it's not going to clog the pores and contribute to acne on the face. Most facial moisturizers these days really are probably non-comedogenic, but it should be labeled as such. So just check your product and make sure that it says non-comedogenic on it. And then as a dermatologist, I have to put in a plug for sunscreen here. We don't really think about sunscreen as being an active ingredient for acne, but acne with its kind of dyspigmentation that it leaves behind, sun protection is really, really key to help get rid of that dyspigmentation sooner and prevent kind of long-term pigment issues on the face. So I recommend applying a broad spectrum sunscreen of SPF 30 or higher every day, rain or shine, no matter what, even if you're in quarantine. And then at night, you can repeat that salicylic acid cleanser, or if you run on the drier side, just use a gentle cleanser. And by gentle cleanser, I mean something that's not labeled as being an acne cleanser. Then I would apply a pea-sized amount of a retinoid gel, such as Differin, to the affected areas. So typically, I tell my patients a pea-sized amount for your entire face. You don't want to spot treat. And because the retinoid is anti-aging, really has a lot of benefits for the entire face. You can also use a thin layer on the chest and back if you have comedones there. And then follow it again with a moisturizer. If you're starting to get some of the inflammatory lesions, which usually we see comedones and inflammatory lesions kind of coexisting, but if you're starting to get some of those pink bumps, those painful bumps, the pus bumps, then we expand the treatment regimen a little bit. So in the morning, I would recommend washing with either a salicylic acid cleanser or a benzoyl peroxide cleanser. Then you can use a benzoyl peroxide cream or gel to either do your field treatment or your spot treatments, followed by a non-comedogenic moisturizer, and then your sunscreen as your last step on top of all of that. At night, I would either wash with one of those 2 medicated cleansers, or again, if you run on the drier side, just pick a gentle cleanser, followed by a pea-sized amount of the retinoid to the entire face and a non-comedogenic moisturizer. Just some treatment pearls here. It's important to know that all treatments can actually make your acne flare a little bit during the first week of treatment, the first few weeks actually. And I think as long as you're expecting this, it kind of helps prevent some frustration you may experience. And really it takes about 8 to 12 weeks on average to see the results of your regimen. I always tell my patients that consistency is key. It really takes daily, regular use of using these active ingredients to reap the rewards, and the medication doesn't work if you don't put it on. So it's really important to make a concerted effort to get in a good habit of doing your skincare regimen every day. So a lot of times patients ask me, well, how do I know when I need prescription treatment? And really, there's a variety of reasons to come in the office to see us for your acne. One is if your acne is worsening despite maximizing all of these over-the-counter ingredients. 2, if your acne is starting to scar or leave behind persistent discoloration, it's a reason to come in. Anytime the acne is causing psychosocial repercussions, time to come in. I also want to mention that family planning is an important time to come in to talk about acne. There's a lot of active ingredients for acne in both topical and oral medications that are actually contraindicated for pregnancy or breastfeeding. So if you are in that stage of your life and you want to keep treating acne, really important to touch base with a dermatologist. And of course, anytime, this is our bread and butter, we're happy to see you to talk through what you're using right now and what prescription treatments may help kind of improve whatever type of acne you've got going on. Um, as we've learned through this pandemic and doing a lot of teledermatology, acne is one of those diagnoses that really is well suited to doing a virtual visit. So we're happy to see you that way as well if you don't want to come into the office. There's also kind of certain in-office products and procedures that can really help augment your acne regimen. And so I'm going to have Alysha, our medical esthetician here, kind of run through some of those key products and procedures that may be helpful.
Yes. Hi, everybody. As Dr. Sellinger said, I'm the lead esthetician here at Cell Skin and Laser. I've been an esthetician for 19 years, and by far acne is probably one of the most common concerns that we see. Along with your oral and topical medications, there's a lot we can do in treatment. When you're thinking about products and service, think of it as diet and exercise. You have the best results when you combine both of them. So when acne, unfortunately, it's not just young people anymore who have acne. A lot of people like myself are struggling with the anti-aging, anti-acne at the same time. So in office, we combine all of the lovely ingredients that Dr. Sellinger talked about into a very concentrated treatment. The most common and most effective is going to be a chemical peel. With that, it is really important to let us know, your provider know, if you are on any oral medications or topical medications, because that will change some of the treatments that you can safely get. Sometimes it will cause photosensitivity, so SPF is imperative to your routine. When we talk about the salicylic acid, which is the BHA, and the AHA, when you combine them, it's like a superpower. So one of the products that's really great is the Skin Medica. It's called Aha Baha Cream, or AHA BHA. They make an exfoliating cleanser, which if you want to use as a mask at home, you certainly can. I know she was highlighting one of hers, but what you do, and especially in the morning, because you want to make sure you have a clean face, if you just slightly apply it with a damp face, let it sit on, brush your teeth, and then scrub it off when you're finished. It will allow about 1 to 2 minutes to actually work its magic. When we use cleansers, a lot of the times we put them on and wipe them off within about 20 seconds, but you want to make sure you have them on for about 30 seconds to make sure those acids can work their way in there. If you don't have the patience to use that, the cream is really great because it is a topical form of the AHA and BHA. So you're working multiple layers to help target the problem areas in multiple layers of the skin. For people who want to go a little bit more of that gritty, when you want that exfoliation, you want to be really careful about what you're using, because some of the treatments have bigger molecules or bigger exfoliation manipulation. Some of them aren't as rounded, so they can actually rip your pore open, spreading that bacteria across your face, making the problem worse. Obviously, that's not what we're trying to do. So some of a clarifying exfoliating cleanser from SkinCeuticals helps, because all of those beads are rounded, so you can safely manual exfoliate some of that dead skin that hasn't made its way off yet without spreading the bacteria across the face. Something like this is not ideal for day or everyday use or twice a day use. So you want to use one of the cleansers that she recommended and introduce this maybe 3 times a week. Right now, with our weather going from hot, cold, our skin doesn't know what to do. There's not as much humidity in the air, so our dead skin is hanging on with all of its might. So our skin is not sloughing off the way it's supposed to. So most of us do have a little bit increase of breakouts. Something like that will help significantly help all of the skin that was ready to come off, allowing your new cells to grow properly, and then limiting the amount of dirt and bacteria that's on the face. Another powerhouse that we use is a serum. So I love analogies, and pardon myself, a serum is like a shot, where a moisturizer is like a cocktail. It's just a lot concentrated. One of our most popular is the IS Clinical Active Serums. Now this is considered a botanical product. For people who have really sensitive skin, really reactive skin, it's not ideal because it is got a lot of sensation to it. This one is one of the rare treatments that will actually target that P bacteria, but also hold hydration within the skin. This is ideal for a lot of male clients or a lot of teenage clients because it gives that sensation. It can feel like a little bit of like a rubbing alcohol or a sea breeze when it goes on. But what that is it's targeting that bacteria, but retaining that hydration, because if you don't have hydration within your skin, your body will create more and more oil to make up for that hydration. So you're kind of working against yourself. So a lot of the times we have a lot of different chemical peels that will work to whatever level of acne you are experiencing, whether it's hormonal acne, whether it's more of the inflammatory. We have so many different treatments that can target each and everybody's concerns. So you can either have a telederm consultation or come in and we can take a look at your skin, take a look at what you're using, set you up with the proper routine. Typically, for some of the lighter peels, we'll start with once a month. And when you are introducing yourself into the world of peels, it really is nice to start with a little bit lower and then work your way up, because there is definitely a learning curve. You have to get used to the shedding and there is a process. So we want to make sure you understand that before you get started. Another thing is, once you have passed and you have cleared all that acne, you may have a little bit of scarring left over. We have a few different treatments that we can target that. Some of them are microneedling is by far one of the best for scarring. Myself, I tend to pick as well. It's hard not to, but when we do pick, you are not only causing scar tissue, but you're causing a difference in color. So you'll have pigmentation scars as well as textural scars that we can treat with either chemical peels, a hydroquinone product, or the microneedling treatment, or even laser. So the important thing to take away from all of this, because I could literally talk all afternoon, is there is so many options for you. But getting in and talking to one of us, your dermatologist, your esthetician, to figure out the right avenue for you and your skin, it can help pretty quickly and pretty efficaciously. So don't hesitate to reach out with any questions. I'm going to turn it back to Dr. Sellinger.
Perfect. Thank you so much.
Yes.
I think it's important. Yeah, a lot of people don't realize that we like to work as a team.
Mm-hmm.
So yeah, lots of options out there. So at this time, we can take any questions from you guys if there are any. Otherwise, again, we are happy to see you via teledermatology or in office to address all of your acne concerns.
If you want to make sure there's a question and answer, just put your answer in the box.
Perfect.
All right. So we'll answer this one live. For microneedling, when you have your appointment, basically what we ask you to do is, if you want to stop, if you're using a retinol or retinoid acid, if you want to stop it maybe 2 days beforehand, you don't necessarily have to, but it is important that post-procedure is the most important thing. So we ask at least 24 hours minimum of no cosmetics, no sunscreen, no exercise, no creams. Don't go take hot yoga. Don't let a dog lick your face. The post-procedure is going to be more important than your prep for it. What we do is we make sure your skin is properly sanitized before we start the actual treatment. We will go through post-care with you. We will give you the products that you will apply for the next 24 hours to take home with you. Don't use anything that you currently are using. Only use what we give you, and the post 24 hours is the most important. If you do come to your appointment and you have some active pustules, provided it's 1 or 2, we will work our way around it. We just will not treat that area so we don't spread it. If you have more inflammatory pustules, we may need to postpone, but as long as it's 1 or 2, we can certainly work around that.
Perfect. I see a few more questions coming in here. Okay. Let's go next to what do we recommend for menopausal acne? So this can be a tough one. Typically, we think of that menopausal acne as being more of that hormonal type. Again, I tend to think about treating that one like I treat any kind of inflammatory acne condition. So all of the ingredients that we talked about, the AHA-BAHAs, the benzoyl peroxide, all of those can be really helpful. The thing, though, that I think can be most helpful is the oral medication prescriptions called spironolactone. What it does is it essentially acts at the level of the hair follicle to prevent the sex hormones, particularly the male sex hormone, from interacting with that hair follicle and causing that acne breakout. Because a lot of times at menopause, when we get that kind of drop in estrogen, that kind of hormonal imbalance is what can contribute to these hormonal acne flares. And again, there are certain medical conditions where, being on that oral medication may not, may be contraindicated for you depending on your past medical history and what other medications you take. But for a lot of patients, it's an easy and safe treatment option, and I would recommend chatting with your dermatologist about that. Okay, and then Alysha, this one can be for you. Yes.
Yes. So the name of the Aha Baha products it's the Skin Medica. So this is what it is: Skin Medica Aha Baha, or AHA BHA cream, and then they have the exfoliating cleanser. If anybody has a Brilliant Distinction point, so if you're a member of Brilliant Distinctions, whether you get those peels or Botox or Juvederm or Cool Sculpting or any of that, all of your Brilliant Distinctions points can be redeemed for these products as well. So it's nice, you can go into your Brilliant Distinctions and see if you have any reward points, and you can use those reward points as a coupon for these products. That one is side note, it does tend to leave, like if you put a lot on before you go to bed, you can spot your pillowcase too. So be careful of that one as well.
Yes. If I've learned anything through all my acne treatment, it's that white pillowcases and white towels are probably best. It looks like we have one more question here, and this will probably be the last one we have time for today. So let's see. My son, 16 and a half, has a few little red pimples. They don't look like whiteheads or blackheads. Scattered throughout cheeks and chin, normal to oily. Has tried different. Clearasil has not really helped. So yeah, he's probably heading more towards that inflammatory acne picture. If he hasn't done it, AHA or BHA, such as salicylic acid, I think that can be a helpful ingredient to try to introduce. Again, as I mentioned at the beginning of the talk, sometimes it's just hitting on the ingredient. There may be ingredients out there that work for everyone else except you. You just got to hit on the ingredient that really works well for your skin. So I would try using something with a salicylic acid in it. But at that point, if it's truly inflammatory acne, I recommend coming in and having your son evaluated with a dermatologist. He's in that age group where it's not uncommon that we start seeing more kind of inflammatory acne cropping up. And there's antibiotics out there, and we tend to select antibiotics that have particular anti-inflammatory properties in addition to being antimicrobial. That may be a good solution for your son. So
having teenage boys myself, I know they're sports helmets, and I know it's a small thing to do, but whether they play lacrosse or football or hockey or wrestling, whatever it is, if you take their helmets and you clean out the chin, the forehead, and around, that makes a really big difference. And putting in their bags, these wipes are so helpful, because a lot of the times, especially teenagers, are not going to take the time to wash their face after practice or anything.
Yeah.
So having these wipes to just kind of clear off all that sweat and bacteria immediately before it kind of settles in will make a huge difference too.
Yeah. So these are the Obagi acne cleansing wipes. They have 2% salicylic acid in them. I actually recommend them to even my adult female patients who do a lot of yoga or other activities where you sweat a lot. It's really nice to be able to kind of just hop in your car and clean your face off right away. That can really go a long way in helping treat some acne breakouts. So I hope this was helpful for all of you. We appreciate your attendance and look forward to seeing you in the office soon if you have any questions. So
if anybody else has questions, you can either schedule your appointments, telederm, or in office with Dr. Sellinger, or you can send on the link to this meeting, you can send questions to that and we can hopefully answer it for you too. Okay. Enjoy your afternoon, everybody.
Thank you. Bye-bye.